Uno elam jongkal yang persya, ubaderu menteri rang ba barim jongka Sorkar Jylla, Dr. Mukul Sangma rengkat ki MLA Kongres hakas ngipalai kilahiar banjure PR teli ki jaka ajung semar haribhoy bakentup ika maternity and child hospital umran yang bernai ban ka sibil hospital nungpo haka jingpyang jongka Sorkar banyak hun nyaka khlam COVID-19 nakal yang Dr. Mukul Sangma hak tega jingjure ulapan pau ba umhun satia bat kena oru ba kadang don sibun ki jingduna baka Sorkar ka syukular chupaj ba bat khlam dale apa dia kakam ulang ru banakal yang ke parti kongres kalda banwat jurip labun teli ki jaka ajing semar haki distrik balalap baga jingpynkhreh ke Sorkar kampar la satia ban penbiang ya kitu ki basya akta nak khlam COVID-19 bar ki don sibun ki jingduna baka Sorkar kamla satia ban penbiang.
Today we have visited that MCH hospital in Umran. The work is still on. Hopefully they should expedite the whole process of this further finishing work of the infrastructure. But as of now, it's not operational. Now, the only facility which is available in Rivhoi district is only this civil hospital in as far as treatment for the COVID patients are concerned. Now, after having seen and after having collected all the inputs here pertaining to the facilities available here, including the manpower, see the facility available here is not enough to save lives. If these facilities would have been ramped up, including the manpower, we could have saved more lives. We have been, from the day one after seeing the death count, we have been very, very concerned about the very alarming number of death count. If you look at the percentage, the proportion between the positive cases, new cases on a daily basis, and the death count, it has been always on a higher side, 2.5% to 3% it went around, which is very, very high. Therefore, it was necessary for us to find out what exactly is the reason. There are a number of factors. One part is that the home isolation part and the delay in decision of the patient to actually shift the patient who require immediate hospitalization, the duration, the decisiveness in transferring the patient to a hospital. Another part is obviously whether in the hospital we are being able to provide the right kind of intervention when the patients admitted in course of the progress of the disease start developing if the cases ultimately turn into critical condition. I am very sad to see that other than civil hospital Shillong, none of the hospitals in the state can actually save the lives of the patients if they develop to more critical condition requiring ICU intervention. Number one, there is no manpower. So though we have the ventilators, though we have the ICU, they cannot be operationalized to save lives. We are very unfortunate to see that we have not been able to be ready. Doctors are here, they are trying their best. I can see the frustration amongst the frontline workers, because what is more frustrating to the frontline workers than seeing their patient succumbing? If they see fatality rate going up, it will obviously have toll on the frontline workers. They'll have real problem of stress and strain. And this is because the facility available, notwithstanding the manpower backup, there should have been people who can operate the ventilators. There should have been manpower put in place who could operate the ICUs to save lives whenever there is a critical case. But this is not happening. This has not yet happened. You cannot expect patients from Nongpo to be shifted to Shillong for further intervention when you're talking about saving a patient which has gone to a critical condition. So these are things which we have discussed. We will articulate them accordingly. The HODs are here. The DCs are now able to understand what are the deficiencies which are identified now how we can actually ensure that these deficiencies are addressed at the earliest and save lives.